Thank you. So it's a pooled out. The study title is pooled outcomes of performing freehand transperineal prostate biopsies with precision point technique. It's a transperineal biopsy technique. For those who are not very aware, probably the radiation team will know better. They were doing brachytherapies earlier in early era. Not currently, not many centers do it, but basically instead of a guide, we use a stepper, and that's a transperineal biopsy kit. So they had conducted a systematic review until October 21. Primary outcomes were cancer detection rates, any grade and clinically significant ones beyond or equal to grade group 2. And other outcomes were understanding clinical detection rates or cancer detection rates in biopsy naive patients and compare that with PIRAT score as well. So 16 studies in USA, UK, 2 from Asia and Australia, roughly around 3,000 in nearly 4,000 TP biopsies conducted. Good point is around 3,400. So nearly 89% biopsies were transperineal local anesthesia. MRI targeting with precision point was done on about 75% studies, not the number, but the studies. So coming to the results, overall pooled analysis of cancer detection rates overall are about 60%, variable range 40 to 80, but the median is 68%, and clinically significant ones are about 42%. Similarly, in biopsy naive patients, which were about half the numbers, 1400 across 7 studies with the available data, overall numbers are 66, so similar, taking you back 66, 68 there and 66 here. And clinically significant ones a little better, 42 in the overall pool and 54 in the biopsy naive group. The table below shows the outcomes of similar overall and clinically significant cancer detection rates with respect to the PIRATS-3. One good takeaway from this is we always say PIRATS-3 nearly about a literature says 20% positivity. So in this particular context, there is a positivity of about 55% if we compare PIRATS-3 lesions and 31% for clinically significant ones in PIRATS-3. PIRATS-4 and 5 are similar what we have as a standard, roughly around 80 and 55 and 90 and 70% in PIRATS-5. Coming to the complications, sepsis varied between 0 to 2.5. Retention, which are very much concerning in TP biopsies, that's the criticism a TP biopsy which always has, but it is not very high, 0 to 4.7%, bleeding 0 to 2.3%. Another criticism for transperineal is pain. So visual analog score for pain quotient is similar, 2.8 to 4.5, and tolerability, not every study reported this, but tolerability between 2 biopsy comparisons was almost similar as per only 1 study out of these comparisons. So number of cores taken, one potential thing, just look at the right side column on the highlighted table or highlighted mark. So number of templates which were taken were very high. The word Ginsburg means there was it's another paper which has been published in 2019. Ginsburg protocol is given for transperineal prostate biopsies. And roughly the number of cores taken are nearly 24. So that's a huge number of cores which they take in transperineal, and majority of the other studies had their respective ways of doing it by having a variable percentage of 20 cores or 28 cores, but majority followed Ginsburg, which is at least 20 to 24 cores. The MRI targeting was cognitive majoritively. The other parameters of biopsy naive versus prior negative biopsies, which we discussed earlier, the numbers are represented here. Coming to the complications, I've just highlighted in urinary retention, because sepsis is obviously going to be less, and that is the main domain, or that is the main parameter in which the transperineal is coming up in a big way. So just look at the urinary retention rates. They are not very high, 1.5, 3.8, 2.5, 0.9, almost 0.4 and 0 at some point of time, and significant number of percentage. Also look into the antibiotic types. So the next slide will give you the antibiotic patterns. About the biopsy naive patients, cancer detection rates were about 54%, which is favorable comparison to the standardized percentages. And efficacy for detection of anteriorly located tumors was apparent in the analysis. Obviously, it's a retrospective meta-analysis. So it's a meta-analysis. So it's not a direct comparison, but overall, the detection rates in the anterior transition zone tumors was much higher, and almost the detection rates in one particular study was about 49% for overall in biopsy naive patients, and clinically significant it picked up to 83%. So if you see those percentages actually change because you're trying to detect an aggressive cancer in the anterior transition zones, and it is indirectly a significant one, and the percentages jump off to 83%. So more specifically about the antibiotics, nearly 3,000 odd patients had mentioned about the antibiotic usages. Out of nearly 40%, that is 1,257 patients did not receive even a single dose of antibiotic. So that it was completely omitted. That's the way the change is happening for transperineal biopsies. Certain limitations are retrospective design, single arm nature, so it's not going to be productive for comparing this particular precision point technique. This particular paper is in favor of precision point technique of transperineal biopsy, so you can't compare that with other techniques. And no stratification, so it's just the number of biopsies, complications, but we cannot actually stratify or find out the data with respect to the patient understanding or patient level factors or the PSA factors, MRI, apart from PIRAD score, other MRI findings or use of MRI and indications of biopsy. So what did authors conclude in this? Authors mentioned that unique aspect of precision point device is its ability to facilitate performing transperineal prostate biopsy under local anesthesia. So what this paper revolves around is utilization of this particular tool, which acts like a stepper on an ultrasound probe. There is a wide bore needle which goes through the transperineal skin. So you try and avoid number of entry punctures into the transperineal skin, that is by minimizing pain and minimizing retention rates. So this is how the overall outcomes are favoring. Thank you so much. I've not gone into the literature source. I think that will be covered in the part of discussion. Thank you.